and I'm here to talk to y'all about CPR. So, how many times have you thought about what you would do if you were walking through the parking lot and an adult passed out, fell out in front of you, and would you stop and check them? Would you check for a pulse? Would you keep walking? Would you call for security? Would you call 911? What would you do? The American Heart Association estimates that only a third of out-of-hospital sudden cardiac arrest victims receive CPR by bystanders. When we talk about sudden cardiac arrest, that is more than just a heart attack. Sudden cardiac arrest is when the wiring system of the heart or the electrical system just completely goes haywire. It overloads the heart, so the heart just decides to stop. Only 8% of patients outside of the hospital that suffer from sudden cardiac arrest survive. When we talk about inexperience, the reluctance and the general disinterest of the public to perform CPR, this drove the American Heart Association to change their guidelines and their standards for performing CPR. We used to talk about, so we have an out with the old and in with the new approach. We used to talk about, we would learn ABCs, airway, breathing, circulation. That is how healthcare professionals as well as laymen or bystanders learn to do CPR from the American Red Cross. We would always focus on their airway, and then we would go to breathing, and then we would start compressions. Now we have changed that to a CAB approach, so compressions take precedence. Then the airway, then breathing. The old CPR was 15 to 2. 15 compressions to 2 rescue breaths or mouth-to-mouth breaths. The new way to do CPR, especially for non-medical people, is to do 100 compressions at 2 inches of depth. The non-medical people have often had resistance, hesitance, lack of compliance when it came to giving CPR to people they did not know. One of the main things that people always think about is spread of disease or infection from giving mouth to mouth. In a 2006 study that was performed, the #1 problem or reason that people gave for unwillingness to perform CPR was the fact that they just panicked. It was not the fact that they could get sick or that they were unwilling to help. They panicked and said they did not know what to do. So the American Heart Association came up with a new approach. It's called the hands-on method or the hands-only method. And that just involves 2 steps. The first step is to call 911. So when you see an adult that goes down for an unknown reason, you pick up your phone, you call 911. Everyone has cell phones. Almost everyone has cell phones. The second thing to do is to start compressions. You push hard and you push fast at 100 beats a minute. And we will demonstrate now on our handy dandy mannequin. You find the nipple line, you go right below it where the xiphoid process or the sternum is. You can feel it on yourself. You put the palm of your hand, your dominant hand down, you lace your fingers of your secondary hand over it, and then you push hard and you push fast. You have to do 100 compressions a minute. This can be done to several different songs. Most people have songs in their heads. For my age group, Staying Alive is one of the most popular themes that we use to do CPR. When we talk about the hands-on or hands-only, 2 easy steps to save a life. 1, you call 911, and 2, you push hard and push fast. Start chest compressions, pushing at least 100 times a minute, 2 inches of depth. So now, when you talk about CPR, should we just disregard the conventional methods of CPR? No. There are times that we should still revert back to conventional 15 to 2 ratios with giving compressions and mouth-to-mouth. The first is with infants and children up to the age of 8. They should always receive compressions and breaths. The second is adults that collapse from breathing problems or respiratory problems. If that is the initial cause of their collapse, then we do the compressions and the rescue breaths. It's important for that. And then the third is adults that are found down with an unknown downtime. Those people that you have no idea what happened, they weren't witness collapse, they have no pulse, they have no respiration, you do conventional CPR on them. So, this is why the American Red Cross, or the American Heart Association, came up with the new guidelines, was to help when it came to the hesitance and the resistance of people willing to give strangers CPR. So now, you'll know what to do when you walk through the parking lot and see somebody fall.